Okay, so I make that 1 o'clock, so I am going to make a start. So first of all, good afternoon, everyone, and thank you very much for taking time to join us on this webinar today. My name is Charmaine Jackson, and I head up the training team for Ardens. I'm also joined by my colleague Christine Batley, who is one of our training specialists, and I'm sure Chris will pop her camera on so you can all see her. And I've also got our head of development, James Wimperney, who's also on the call, and you can see James on camera there too as well. So this webinar is exclusively for Wales practices today. And what we're going to be doing is providing you with an introduction to Ardens. So our aim is by the time you leave the webinar today, you will have a clear understanding of what we do as a company, and more importantly, an understanding of how we are going to help you. Now, in terms of housekeeping, because we want to make sure that you're all getting the most out of the webinar today, what you will notice is you're not connected to a camera or a microphone. So if you do want to communicate with us in any way, then please make sure you find your Q&A button. That's how you can communicate with us. Perhaps you have a question you would like to feedback, or maybe you have some feedback in general that you want to provide for us. And both Chris and James will be monitoring the questions coming through, answering the questions as we go along. And what we tend to do sometimes is break up and discuss those questions verbally as well so that everyone can hear the answer. So please make use of that. And I always say when I'm doing any sort of training or webinars, no question is a silly question. So please feel free to fire your questions away. Talking about questions, I may also launch some poll questions as well. This is just a great way of keeping everyone engaged, hearing from you as well, hearing your input too, giving us some better insights on what's going on in Wales as well. Now, the session has been scheduled for an hour. I am going to keep to that time as much as possible. It may finish a bit earlier. It just really depends on the questions and the feedback that we have in the session. And like I mentioned, the session will be recorded, so you can watch this back after the time. So it saves you writing down loads and loads of notes. If you feel that a colleague would have found this useful and they're not here today, you can also share that recording. So what we would do is we will email out everyone that's registered onto the webinar. You will get a link to the recording as well. Now, in terms of what we're going to be covering, and I'm pretty much going to be doing it in this order as well, we're going to first of all discuss the challenges that you may be facing. We're then going to talk about how we can help you. We're going to look at the resources that are available for you. So we're going to be talking about how we deploy them when you do become an Ardens customer. And we'll also I'll show you a live demonstration of how they all work in your system too. We're then going to look at the packages that we have available and give you an idea of what the pricing is. And then last of all, and most important, we're going to look at next steps that you can take after this webinar today. So really, it is to stress that this is an introduction webinar. So we're going to go right back to basics today to really help you understand what we're trying to achieve. There are some follow-up training and support that you can tap into after this time, and I will talk about what that looks like at the end of the session as well. So I think this is probably a really good time to start with some of our poll questions, and a nice easy one to begin with. It'd be really good to understand exactly what your job role is. So if you just bear with me, I'm just going to pop a poll question up now. It will come up in the middle of your screen, and if you can just let me know what your job role is, that's good. It just gives us a chance to set the tone for the meeting as well. So perhaps you're a practice manager, maybe you're an admin team, maybe a care coordinator who's a little bit more interested in finding out what we do. Perhaps you're a nurse, a pharmacist. Fire your questions away. Perhaps you're none of those roles. If you're not, click other and let us know in the Q&A exactly what role you have. It'd be great to see what we have in the room. And Chris, let's have a look at some of these results here. So by far, we have lots of practice managers in the room, which is brilliant. We've got our decision makers here, got a couple of members of the admin team. We've also got a few GPs, pharmacists as well. Got quite a good mix, haven't we, Chris? So that's a nice audience. I don't know if anyone's popped in the Q&A any other role that they have, but if I haven't mentioned it, do let us know, and it would be good for you to tell us. So next question. Now, I understand that you have recently, well, within the year or so, moved across to EMIS Web. You were currently using Vision before, now you're using EMIS Web. So it'd be really good to get an idea of what your confidence is in using EMIS Web. Perhaps you have not had any training, you've got no confidence at all. Perhaps you are really confident, or perhaps you're somewhere in the middle. The reason why we're answering this question, because then we can see what other training that we can provide you as well. So I'm just going to launch this question here. Let us know where you are with your understanding of EMIS Web. Mixed there. Mixed. So a lot of you sitting under the middle part, confident. Some of you very confident. So that's really helpful to know. So thank you very much for taking time to do that too. And there'll be more poll questions coming up. So starting with the challenge then, now I am sure you can think of plenty of challenges that your organisation may be facing right now. And in a moment, I'm going to launch another poll question just to get an understanding of what that challenge may look like for you. But if I was to step back and if we was to bottle up everything our customers come to us for help with, normally it's these pain points. And I'm sure that you can probably resonate with some of these too. So increasing population need, the more we go on, the more our population is increasing and the more complex those needs are as well. You're being stretched massively. There is lots of work that you have to deliver, and sometimes in a really short amount of time as well. Sometimes your processes are not streamlined, particularly now that not only have you got a new coding system with SNOMED in 2025, you've also got a new system in place for EMIS Web. So how streamlined are your processes? And are you still doing a lot of manual processes, which is probably causing a lot of burden on both your clinical and your admin teams as well? So really the consequences of us still kind of working in these 3 pain points is there be inconsistent care, not just for your processes, but also for your patients, and even potentially missed care for your patients as well. Poor coding, that makes it really hard to measure your performance, to see where you are. And it could also lead to missed payment for certain contracts too. I've spoken about workload already, increase in workload. There's inconsistencies as well. That makes it hard for us to ensure that coding is accurate. It also is hard for us to track performance, like I mentioned, and also gives us good visibility of exactly what's going on, not just at practice level, but across your cluster too. And it's not on here, but let's not forget the number of contracts that you need to work towards, whether that be local contracts or national contracts. There are so much different guidance, and sometimes that's all complex too. And that's adding another pain point on top of everything that you have to be working towards as well. So hopefully a lot of it you will resonate with, but it'd be really good to just fire off another poll question for you to just help us understand what's your current challenge in your practice right now. So just bear with me. Now, this is not a multiple choice question. This is you just popping in a few words on what your pain points are. I'm just going to hit launch there. And if you can just pop in a response, that'd be great. And we can have a look at some of those that are coming through. Patient demand, recall schedules, another one for patient recalls as well, complexity, patient demand. Yep, clinicians very poor. I don't know what you mean by that, but hopefully that might mean poor coding. New starters, I'm sure training is also a challenge for you. Lack of staff, transfer of workload, processes, unrealistic expectations. These are all things that we have heard when customers are coming towards us. So it's really good to see that this is the same, well, not see that you've got the same problems, but also shows that we can help you as well. So we will make note of some of these challenges that you are currently facing. So thank you very much for taking part in that poll question. So thinking about all of those challenges then, this is where we want to help you, not just with those challenges, but with much, much more as well. So we provide a clinical decision support and workflow optimization solution, which is fully embedded into your clinical system. So for you guys, we're talking about EMIS Web here. The resources we provide as part of our Ardens clinical products, which you can just see over on the left-hand side there, just here. This will ensure that your practice staff are following the latest best practice guidance, local contract requirements, national contract requirements, and thinking back at those challenges, it's also helping you to ensure that the patient data is captured consistently, accurately, and more importantly, that there is no care that is missed there. So although today we're going to be focusing mainly on Ardens Clinical, because this is where we provide you with templates and reports, which I'll show you in a minute, it's also worth bearing in mind that we do have our population health management tool, which is called Ardens Manager. And what that does is all of the information that you've accurately captured within your clinical system, it extracts that information, it puts it into easy, readable, and really nice visible dashboards, which then allows you to be able to see greater insights into tackling your population needs at a wider scale. So not only looking at what's happening at your practice, but also across your cluster as well. So bringing you back to those challenges we just spoke about then, really what we're here to help you do is to create better outcomes for your patients, to reduce your workload, to help you save on time so much more, and you'll see that in a minute, to improve data accuracy so that you really are maximizing your contract payment and your performance, plus so much more that we're here to help you with as well. So this here is just giving you a breakdown of the benefits, particularly for you as GP practices and also across the clusters. So for GP practices, it's really about improving patient care. Patients are at the centre of everything that we do, managing that demand, saving that time, making sure that you're getting paid for the work that you're actually doing as well. For your clusters, again, this is around saving time, and it's helping them make data-led decisions because it's now based on accurate information. So it makes them understand exactly what diagnosis they have, what reviews need to be done, what patient care is missing. It gives them better information to look at. Now, what I'm going to ask my colleagues to do is just pop the website, our main website, into the Q&A so that you can look at your own time at all of the different benefits. We have that all on our website. It also gives you more detail about Ardens Manager should you wish to learn a little bit more about that as well. Okay. So as I mentioned, we're going to be particularly looking at the Ardens Clinical product today. And what Ardens Clinical does is we provide you with clinical templates. So for our clinical templates, these are helping you with structured and consistent data. We are also helping you with recall systems. So that came up quite a lot when you were telling us about your challenges. So we've got some really robust recall systems in place to really help you identify the care that's needed for the patients at the right time. So this is looking at areas such as long-term condition management and also vaccinations we can help you with too. And we also provide you with data quality reports. So these are really popular, highlighting where things are going wrong, where you are going to miss out on that patient care or you are going to miss out on payment. And I'm going to demonstrate what all this looks like shortly. Then Ardens Manager. We're not going to cover Ardens Manager today. We are going to put some information in the Q&A for you. But a reminder, Ardens Manager is our population health management tool. It has over 20 different dashboards available for you to help you monitor performance in areas such as conditions and also contracts, appointments and vaccinations and much, much more. And with Ardens Manager, it does give you the ability to benchmark activity across your organisations, to be able to monitor trends over time and to be able to view patient data within Ardens Manager, and there's so much more coming with Ardens Manager too, so it's definitely worth having a look at the information. So I'm hoping that is all making sense so far, and do give me like a thumbs up just to make sure that you're all happy with the information that's being shared. You can pop your hand up, that'd be great. And then what we'll do, thank you very much, is we'll move forward now with looking at how we actually deploy the resources in your system. So if you do decide that Ardens is for you and you sign up for Ardens, it is a case of us deploying all of our resources to you. Now, before I launch into a live demonstration, I wanted to give you a little bit more context on how we actually deploy these resources, because there is important information that you need to know. So across Wales, you are using a module called Template Manager. And hopefully most of you are aware of what Template Manager is, but it's a place where we, or you, or us, manage templates, protocols, and documents as well. The thing with Template Manager, it's very much a manual process. So when it comes to us deploying the resources to your practice, you will need to provide us with a secure login. We will then access each practice system and upload all of our resources. So that has to be done on a manual basis for each practice, but we're still keeping you up to date with all of our latest resources. So this is currently what you have at the moment. In the future, or what is coming, is a module called Resource Publisher. Now, I'm not sure if many of you have heard of Resource Publisher, but what that is it allows resources to be centrally shared with organizations who sign up or agree an agreement, basically. And it just means that we can hit one button and all of those resources are then automatically published to you in one go. And it's just much more easier for us to deploy the resources, and it means that you get quicker access to all of the latest updates as well. So we are currently working with Opton, or EMIS, as you may know, to help roll out Resource Publisher across Wales. Unfortunately, it's not here at the moment, but it's something that we are pushing towards. If you are finding that you're having issues with Template Manager, it might also be worth you pushing this with EMIS too. So the more we're all pushing, the more hopefully it will be rolled out in your area. If anyone has any more information about Resource Publisher or has any questions around Resource Publisher, then please let us know in the Q&A, and then we're more than happy to answer those questions. In terms of reports, those are managed separately, like you know. So any templates, protocols, documents are all within Template Manager. When it comes to reports, that's all in the population reporting module. So within population reporting, I'll show you in a minute, there'll be an Ardens searches folder that we will import for you. And that will contain all of the different reports that we have available. Now, what we also have is what we call our Ardens download portal, and that holds all of our reporting folders. So as soon as you do sign up for us, you can go away straight away and you can start downloading any reports that you want to use right now rather than wait for us. We can deploy them for you, but it's just a quicker and easier way for you to be able to access those reports right now if you do decide that you want to do that. So hopefully that makes sense too. So in terms of what's available, and I'm going to show you this live in a minute. So at the moment, you will have access to all of our different templates that we have available. And these are all around making sure that you are creating structured consultations within your practice. So it will have all of the relevant codes that you need to be using for that particular area. They all follow best practice guidance to make sure that your clinicians are following that latest guidance too. And not only do we have templates for clinicians, we also have templates for the admin team as well. So perhaps they need support to record data for new patients coming in, or perhaps you've got a patient who's borrowed equipment from you and you want to record the fact that the blood pressure machine has gone away with that patient. So we've got loads of different admin templates available, just as well as clinical templates too. And you'll access all of these templates manually within a patient record, open up a consultation, you run template, and all of those templates would be available for you. When you do come over to Resource Publisher, we will further advance that functionality for you. So when you're on RP, what you will also have is a template launcher. So rather than you having to go into Run Template and find the different templates that are available, you'll be able to just press F12 on your keyboard, launch our template launcher, and that will then provide you with a package of all of the resources for that particular area. So for example, if I'm a clinician who's seeing a patient for sore throat, I can launch the launcher. It will give me easy access to the template to allow me to record information, and it will also give me access to a formulary. So not only am I recording the data accurately, I'm also making sure that I'm prescribing safely for that patient and I'm following the latest guidance too. Not only will we put launchers in and formularies in, but we will also put in analyzers as well. So these are really popular with our England practices. And what this is identifying is any outstanding care for the patient. So they'll live within the pink box. You will hover over it and it will tell you of any outstanding blood tests, any outstanding contract work, or important information that you need to know for your patient. We will import documents for you too. So what's really popular is our bravery certificates. So we have a number of different bravery certificates that the nurses find extremely useful. So perhaps you've got a child coming in for a vaccination and you want to produce them a bravery certificate, perhaps maybe an adult, we don't judge here, but the bravery certificates are there. We also have care plans that are available for you as well. So loads of useful documents that you can launch in real time for that patient if needed. Patient information leaflets, we've also got child safeguarding reports which are available too. When you get Resource Publisher, you will also have the launcher. So instead of going to document, create letter, you'll be able to go to F12, fire off exactly the document that you need. It's just an easy way of you getting to it. But you can see there the number of different document templates that we do have available for you. And then lastly, before I launch into a live demonstration, we also have a report. So this is the report folder that I mentioned that will go into population reporting. That's then broken down into the different categories. And you can see there that we've got loads of different reports to help you with loads of different areas, such as administration, you've got drug monitoring there, you've got safeguarding, you've got vaccinations. And each of these will include reports to help you identify data quality issues, to help you recall patients, to help you monitor and track your performance within your practice too. So that's kind of everything that I wanted to show you on the power slides, just to give you a bit of an introduction. I am going to switch over to my live system or my demo system, but before I do that, I'm just going to check in with Chris to see whether there are any questions or anything else, Chris, that you want to add at this stage while I launch EMIS Web.
So Percy has asked, how quickly will you deploy searches, protocols, policies, etc. for us to use in the current QAIF QIF year? As historically in Wales, there's always been a delay.
Okay, James, can I bring you in on that one?
Yes, I've just popped a response to that, but our aim is to get any contract information out as close as we possibly can to the contract start date. So it is not unusual for the clinical system suppliers to be multiple months behind contract start dates due to all of the testing they have to run through with the relevant health boards and government organisations. Whereas for what we produce, we look to get the raw contract information to the hands of practices for the start date, so they can actually actively work on those patients rather than wasting 6 months of the year or having to do backdated work.
And that's the massive benefit of Ardens, isn't it? Particularly that we hear from our England practices that we are very quick on making sure those contract resources are ready right at the beginning of the year. So yeah, just something to think about. Any other questions, Chris, or anything that you want to add?
No, thank you.
No. Okay, thank you. Okay, so I'm just going to really quickly, I'm going to start with templates first of all. You should be able to see my EMIS system. This is a demo environment, so any patients that you see on screen, it won't be real patient information. What I want to show you very quickly, first of all, is where we will import the templates within Template Manager, and then I'll show you some examples of what the templates look like. So if I go to my EMIS bubble, down to configuration, and then into Template Manager. You probably may be using this already for any templates that you're creating. Remember, we are saving you the headache of having to create your own templates. We do it all for you. We will make sure they're all updated as well. When we import the templates, so under the templates and protocols area, there'll be an Ardens folder, and that will contain any templates or protocols that we import or make available for you. We will also pop a folder in documents as well. So you'll have an Ardens national document folders, and that will include all of our different documents that I mentioned. So your care planning, care consent forms, etc. And for some of our templates, there may be library items. So in that case, there'll be an Ardens folder in here, but you don't need to worry about that because that's all embedded within the clinical system. So there'll be a folder in each of those tabs there. Now, it might be worth bearing in mind that we only update anything and in the Ardens folder. So we don't touch anything outside of the Ardens folder. It's always a good time then to have a look at what else you have in your system. And we can do plenty of training on housekeeping your system as well, making sure that your practice staff are using all of the latest templates. Okay, let me just turn some of my notifications off. 1 second. Okay. So now looking at how to access the templates and what they look like. I'm just going to swap systems quickly here. So I'm in a consultation. So I pick my patient and I'm in a consultation now. So I open a new consultation. And it really depends on what the patient is coming in for. Now, when it comes to accessing an Ardens template within your EMIS system, it's no different to how you're accessing any other template right now. So your clinician will click on Run Template. And when they hit Run Template, it will open up the Template Picker screen. Now, from here, they would then go ahead and they would search for their relevant template. Now, in order for you to identify what an Ardens template is, Ardens will be in brackets. So that's how you will clearly know which one is one of ours. So you'll be pointing your staff this way. Over on the right hand side, you will see the folder structure here. So if you wanted to have a look at what is available, maybe you want to do that to start with to get used to knowing what we have. Over on the right hand side, you will have an Ardens folder, and that will include all of the different templates that we've deployed to your system. It's worth noting that when we deploy it to your system, it will be active by default. So you don't need to go in and start switching anything on. As soon as it's in there, your staff can start using our templates straight away. The template structure is pretty much the same with any Ardens template that you access. So first of all, make sure that you're picking up an Ardens template. I'm going to pick up asthma as an example. And it's just, again, to mention that we have templates for areas such as long-term conditions, procedures, we've got admin templates as well, and you'll be able to see a full list of what those look like on the right-hand side. So I'm going to open up a single long-term condition template now. So we have a template for each of the common conditions: diabetes, COPD, cancer, depending on what you're reviewing for that patient. I'm going to open up the asthma review one as an example. How an Ardens template is structured is by pages on the left-hand side. So what we do is we break down that information in the template. So rather than giving you everything on one page and you've got to do a lot of scrolling, we've broken down that information for you. And that just makes it quicker for anyone in the practice to be able to open up that template and go directly to the information that they need. Now, note here that we've got a contracts page. At the moment, I'm looking at QOF, which is a contract that the England practices follow, but you'll have something similar for anything that you're following within Wales. So this here will list out any of the payment codes that you need to be capturing for that particular contract. So it's really straightforward. It tells you exactly what you need to be working towards, and the stars next to each of the fields will let you know that that is for payment purposes. On the left-hand side, then, you would then complete the information that you need. So perhaps you're a nurse and you have got the time to be able to do a full review for that patient. What you will be doing is you'll be completing the review pages. So within the review pages, not only are we incorporating the payment codes as well, we're also incorporating best practice information. So anything in black bold writing indicates that's for best practice purposes, all following the latest NICE guidance. We will use codes as much as possible because we want you to be able to pull that information out to be able to report on certain areas if you need to. It also works with Ardens Manager really well as well. So everything you will find will have a code attached to it. It also means that on the right-hand side, you can then look at previous information that has been entered for that patient. So for instance, patient already had a symptom of cough back in February 2026. The template would be filled with drop-down fields, perhaps calculation fields, numbered fields, so value fields. We also have links to important information. So very much the standard information that you would be used to seeing in a template. But what we've done here, you can see, is we've structured it nicely for you. So for your clinician, they'll be able to capture the history, any triggers, and they would work their way down the template with all of the information that they do need to capture. And that works the same for each of the pages. We've also got the vaccinations page. So perhaps you are doing an ad hoc, I don't know, flu vaccination for the patient, or maybe COVID, or maybe pneumococcal. You then got the options to record the vaccination at the same time, rather than you having to go into different templates to be able to do that. So we're trying to make every opportunity count with that patient in front of you. You mentioned recalls. So here's our recall page here. So if you want a reminder in the patient record that that patient needs to come back in a year's time for their annual review, then you can pop in a diary entry. But note that we've also got some real good, robust recall systems in place that doesn't rely on the use of diary entries, because sometimes they can be quite hard to manage. We've got a whole load of reports which will allow you to bring those patients in around their month of birth for the care that they need. Resources and patient messaging. So this is really useful if you want to be able to share some useful patient leaflets with your patients. We've even got text messages here. So if you want to quickly fire off some texts for your patients and you want guidance on the actual wording here, just copy that information and then use it as part of whatever third-party messaging system that you're currently using. And it'd be interesting to know what you're actually using in Wales when it comes to your third-party messaging system. So perhaps maybe pop something in the Q&A. I know for England we use AccuRx and iPlato and companies like that, but it'd be good for us to understand what you're using in your area. You've also got the leaflets here, so anything with a blue link, you can just click on the link, and then what that will do is it will launch that leaflet so that you've then got the link there to be able to text that out to the patient if you need to. Template info and learning points. So this is really useful if your doctors want to be able to update their appraisal toolkit at the same time as well. They've got the option to be able to do that. Same for your nurses too. So that takes you to areas such as clarity, 14 fish. If there's anything that's missing on there, do let us know and we will be more than happy to look at adding that too. So that's how your standard Ardens template will work. Really, really straightforward. And this particular one, like I mentioned, is looking at a patient who has a condition of asthma. But I know what you're probably thinking. Half the time the patient's not coming in for one condition. Most of the time the patient's coming in for several. So what happens if I've got a patient who's got asthma and they've got diabetes and they've got a mental health condition as well? What you don't want is your GP to go into 3 different templates to complete that information. So this is where our long-term condition review template is really useful. And I'm just going to show you what that looks like now. So I'm back into my run template. And then I've got the LTC review template. So this works really well with our long-term condition recall reports, which I'll show you a bit later on as well. Click on OK. And then on the left-hand side, you've got all of the condition pages here. And instead of going into all of those individual templates, your clinician will instead go open up this template and go into the individual pages and then complete the information. When you get Resource Publisher, this template will be further advanced. It will be a smart working template. So when Resource Publisher is in place, what will happen is these pages will only appear if this patient has that particular condition. So if they only had asthma and heart failure, then it would only show me those 2 pages there. So it's really useful, and that will be available as soon as you're over on Resource Publisher. What this is doing, it's just giving your, we've got 2 templates. We've got an initial template for your healthcare assistant so that they can capture all of the initial examination findings. And then you've got a template for your GP and nurses so they can almost fill in the gaps from what the healthcare assistant couldn't complete. So they'll be able to see all of the information that's already been captured for that patient and then use the drop-down fields to make sure that you are meeting all of your contract requirements or patient care for this area. Other quite popular templates, I'm going to show you a couple of more and then I'm going to move on, but other couple of templates that are quite popular is our procedure template. So nurses love our procedure templates. They find it really helpful to follow. So for instance, we've got our minor surgery and joint injection template, but we've also got templates to help with wound management, for instance. That's quite a popular one too. And what it would do is it will help you to assess that patient, making sure that you're doing all of the pre-assessment questions with that patient, making sure there's no contraindications or allergies that you need to be aware of. And also we're helping you with recording the fact that the patient has given consent for you to perform that procedure. We also even have consent forms that you can complete and hand over to your patient as well. And then when it actually comes to recording the procedure, we then have a section in all of our templates which will allow you to record it. So this is really useful, particularly if you're working towards anything local. Normally with local specifications, it normally is around procedures, particularly around minor surgery and wound management and things like that. So here, this will just ensure that your practice staff are recording the information that they should be. And then last of all, we do have specialist templates as well. So perhaps you've got a female patient that's come to see you. They are concerned with symptoms that they feel might be maybe early signs of menopause, so perimenopause, or maybe menopause. Maybe women's health is not your expertise and you want some guidance to ensure that you're following the latest guidance to make sure that patient is given the right support and care that they need. We have a whole load of women's health templates to help you with everything from fertility to contraception to also menopause as well. So this one here is our menopause template. And it's worth noting that all of the templates that I'm showing you here has actually been built by a clinician, which is even better. So not only are we following the latest best practice guidance and your contract guidance, we've also got clinicians who are feeding into this as well, making sure that there's information there that we feel that will be useful for you. So again, for your menopause template, here it's allowing you to record the symptoms that the patient's experiencing. We're making sure that we're covering most of the symptoms here. And this actual template was put together by not only one of our clinical developers, but an expert in women's health as well. When it comes to the initial consultation, making sure too that you're following that latest guidance, recording the assessment and any outcomes for that patient. You've also got the option for referrals and resources too. So hopefully that gives you a good idea of templates. Chris, is there any questions on templates at all? Anything that you want to add?
No, not really. Just I've been posting as you've gone along. There was just a couple of comments that certainly a couple of practices in Wales use iPlato rather than AccuRx as their text messaging service.
Perfect. All right. Thank you, Chris. So moving on then to document templates. So this is where we provide you with useful forms or leaflets or reports that you can generate within a patient record. Remember, when Resource Publisher comes, you will have that launcher to be able to easily access them. In the meantime, it's just a case of going to add, document, and create letter. And this is where you'll find all of our different national documents that are available for you. So you can hit the search button and then search for the document that you're looking for. You can also see the Ardens folder in there. And every time you open up the documents, it will remember that and it will save it under your recently used area. So I mentioned that the bravery certificates are quite popular. Actually, let me open it so you can see it a bit better. Apologies, just wait for that to load. Ardens folder, there's all your different documents. Here is all of your bravery certificates. We've got loads of them there. So it's just a case of just picking which bravery certificate you want. What that would then do, so with any document, what it would do is it would pre-populate the information for you. Again, just saving you a lot of time of having to do that. And you can then print it off the patient, save it into the patient's records, email the document if it's a document that needs emailing for the patient. If it's a document that needs to be part of your referral process, then you'll be able to save it to the patient record as well. But here's my bravery certificate there. It's merged through the patient's name. I can then go ahead, sign it, and save it back to the patient's record. Other useful documents worth noting, I might just pull up really quickly the child safeguarding report. So here I've got the child in need GP report here, and this is normally one that's quite popular when we're doing some training as well. So if you need to maybe provide information for a third party, such as maybe the social care or perhaps maybe secondary care, you need to provide them with information for this child in need. What this would do is it will allow you to be able to feed information into a report that you can then produce for them. So if I just go back into here, it may bring up some prompts. So this here is just saying, look, what consultations do you want to include? So I'll just tick what consultations I want to include in there. I then can pick which items I want to include. Perhaps I want to say when vaccinations were given for the patient. What problems, and I don't know about you, but when we tend to go around practices and we do training, problems seem to be a problem. We're recording problems that are not problems, and this is a good example seen in ENT clinic. If I don't want to clog up my actual form, I can untick anything that's not a problem, click on OK, and what that will then do is it will populate that into the document for me. And in a minute, that will just fire up. Okay, so here I've got my details in. It's pulled through all of the information from the actual patient record, so that I can go away and I can then use that to be able to send that across to the relevant third-party person. So it's just worth noting that these national documents are there. And then lastly, I want to show you the reports that are available. So I'm going to go into population reporting. And within population reporting, you want to look at your practice area. Within there be an Ardens searches folder. So either you have downloaded it yourself from the Ardens portal, and we will give you instructions on how to do that, or we have deployed that folder for you. And within the Ardens folder, it's broken down into different categories. So for instance, under administration, perhaps you want to be able to run reports on your frequent attenders. I mean, you probably know this off by heart who your frequent attenders are, but sometimes this can be quite an insight at how many patients have had 10 or more appointments in a certain time frame. So we're giving you the option to pick exactly what time frame you want to see who your frequent attenders are. So we've got plenty of different appointment reports, also carer reports, etc. We've also got condition reports. So these are really useful to help you understand the activity for last month, how many diagnoses have happened, what activity has happened in the last year, which is worth you noting, what screening has taken place, particularly if it's for your cancer patients, as well as case finders where you may want to potentially investigate that record more because they might be missing a diagnosis code. So plenty of different reports for all of your different conditions. You've got your contracts. James mentioned this earlier. So soon, once we have this information available, there will be a folder which will incorporate all of your different contract searches. I believe in Wales, your QOF version is called QIF. So basically just similar to what we have for our England practices, you will have all of your searches in there to help you monitor performance in that area. You've also got areas such as drug monitoring. We've heard that this is an area that you are quite focusing on within Wales. So here is our monitoring searches here to help you be proactive with patients who need to come in for their medication review. So rather than you having to rely on your medication review date and diary entries, what we've done is produced invites for you to help you understand which patients are due their drug monitoring based on any investigations that they currently need right now. We also break that down by registers too. So you can look at, for instance, who needs to be invited in annually, anticoagulants, DMARDs, high-risk drug monitoring, and also providing you what's still left to do. These are really good as well, really useful for your pharmacist. So this is saying, look, these patients are on this medication, but they're missing particular investigation, which is a requirement as part of their monitoring. It's not just reviewing the medication, it's investigations that they currently need as well. And in other areas such as safeguarding, we've also got vaccinations. Now, I do understand that you are maybe currently using something else for your vaccinations, but it might be worth noting that we do have our routine vaccination searches to help you with areas such as childhood, pneumococcal, RSV, shingles, COVID, flu, depending on what you're doing in your area. And for each of these, what we do is we provide you with some invite searches so that you can recall those patients in at the right time. So these are really useful to make sure that you're managing that workload. Let's remember that pain point we had about the amount of work you're having to do. Let's try and make sure that we manage that a little bit better. And this is where your invite reports can help you with vaccinations. We do also have our recall searches. I believe, James, you can tell me where they are. Otherwise, there we go. We've got LTC. So under LTC, we've got our LTC review searches here. So this here is a recall system to help with patients who need to come in for their long-term condition reviews. It's based on calling patients in around their birthday. So you've got that structured approach to inviting your patients in and helping you manage that process. We don't just focus on anything relating to contracts for long-term conditions. We're also trying to help you incorporate best practice too. So here, we then provided you with some annual review searches to help you identify which patients need to be invited in for their review. So here you go. This is everyone that needs to be invited in, depending on what their birth month is. And what we also do is we exclude any patients out who are vulnerable. So you may want to consider your dementia patients, your end-of-life patients, your learning disability patients, or those patients who have reasonable adjustments. You can then invite the patients in. It then makes sure that your clinicians are seeing the right person at the right time. They can then use our LTC review template to then guide them through completing that annual review. Patients then done for that year, you've met all of the contract requirements and best practice requirements. The patient then comes back into your recall system the year after, then to be able to invite them in again and start that whole process again. We also have planning searches. So at the start of the year, we tell you exactly what your recalls will look like throughout the year, so you can then manage your workload too. So it's just worth noting that we do have this recall system in place to help you with your long-term condition management. And I think that's everything else that I want to show on reports. So just checking in to see if there's any other questions. Otherwise, I'm going to fire off another poll question. just to see how you feel about those resources and if there's any more support we can give you. So James,
Hi,
Chris, any questions?
Sorry, a couple of questions.
Yeah.
One about documents. The documents in Wales have to be bilingual, so I suspect they had to be in Welsh as well as English. Is that something we would talk to the Welsh practice about?
I'm assuming so, but James, you can give an answer on that one.
Yeah, so I was just posting a response to that. It is certainly on the roadmap for our Welsh resources, and we're just currently investigating the most practical and safe way to implement that.
And the other one was about supplementary services such as LARC, treatment room claims, etc. And I said that we had them in England. James, would they be something that we'd have?
So if Charmaine opens the procedure folder in the search suite, we will be deploying a full suite of minor surgery, minor injury claims, as well as women's health. So these will display the activity and allow for those claims. If there's more specific cluster-based contracts that need to be fulfilled, then that's something that we'll explore as part of our Plus contracts.
And then finally, this one's just come in, so I haven't answered this at all. We're still expected to carry out QIF work, but it's not measured as such. We're actually measured against the insurance framework since October 2023, and it's those reports that the health boards are using during our annual assessments. Anything on that at all?
So we're currently working through all the contract elements that are required specifically in Wales, because obviously, as the users just stated, that things are not measured against them, but it's what's required. So if there is any specific areas around the contract that you feel will be most useful initially, if you can get those details over to us, we'll look to prioritise those areas. But we are slowly working through all of the current in-flight contracts for Wales.
Thanks, James.
Thank you.
Any more questions, Chris, or is that everything for now?
That's it for now, I think.
Perfect. I'm going to fire off another question. So you've seen all the resources now. It'd be really useful to know what you think would be most useful for you right now. So I'm just going to launch it. Really simple question. What Ardens resources do you feel be most useful? Is it our clinical templates, our document templates, our reports, maybe all of them? It'd be good to get your answers on that one.
Charmaine, another question has just come in. Do you do a trial demo for interested practices?
Yes, we do. So watch this space. I'm going to talk to you about it in a minute, and you can sign up for a 3-month trial. It looks like reports are actually a mixture between reports and templates, which you'll feel would be most useful. Actually, the numbers are not quite balanced between all of them, so it's good to know that we're going to be able to help you with all of that. Now, another quick poll question. Obviously, you've seen everything, not everything, because there's so much here, but it gives you a taster of what we are going to provide for you. It'd be good to know if there's anything else you think you need our help with. So this question is just, what else would you like to see Ardens help you with? It's just another free text question. I'm just going to launch it and have a look at some of your responses. So what else would you like to see Ardens help you with? And while that is firing off, I'm just going to open up my presentation slides again. Admin time, recalls and processes, service claims, that's coming up. More admin time, more document management, recalls is coming up as well. So hopefully a lot of this is covered, but we will make sure we take that back and make sure that we have everything that you need. Yeah, recalls, searches, streamlined processes. Yeah, thankfully I can confidently say that we can help you with all of that. So that's good to know. Okay, so leaving us then to just the last part of the presentation now, and that's looking at packages first of all. So as part of Ardens, we have 3 packages available. We have our starter package, we have our plus package, and we have our pro package. So for the starter package, this is all of our national clinical templates. It also includes all of our data quality reports. It includes the long-term condition recall system that I showed you, safety alerts, medicines management resources, and also analyzers as and when you get your resource publisher module. So that is currently 23p per patient. So this is just a rough idea of numbers. Of course, when you sign up, maybe as a group of practices, there will be discounts and things that we can consider. You then got your plus package. So this is everything in Starter, but it also includes us helping you with your local requirements. So what we'll do is we'll receive your local specifications and we will turn those into templates to make sure your staff are capturing the right information that they need, also reports, and also we can provide you with a dashboard as well. And then last of all, you've got our Pro package, and this is everything in your starter package, everything in your plus package, but on top of that as well, it's also helping you with our with your referrals. So anything that you need to send off to secondary care or maybe the community, you will provide us with your referral forms. We will then turn them into EMIS friendly documents. We will help you to maintain those within your EMIS system to make sure that you are eliminating the amount of referral forms that are being bounced back from secondary care because you're using the wrong ones. So that's our main package, which is Pro. So we've got Starter, we've got Plus, and then we've got Pro. We have got a free trial that you can sign up to, and in a minute I think that might be the next slide. In a minute I'll show you how you can sign up to that free trial. But it's also worth noting as well, it doesn't matter what package you are on, all of it comes with training and support included, and we have a massive amount of training resources that are available for you. Support articles, which Chris has been sharing with you today. We've also got Ardens Academy. That's our online learning platform, which allows you to learn Ardens in your own time. We've also got training with our training specialists. We've got about 9 training specialists. They are all located around the country, and they're here to help you with your training needs. So either we can come out in person or we can do the session remotely and have that recorded. Webinars, we have webinars all the time throughout the year. I will tell you what the next webinar is for Wales. And we've also got our dedicated support team. So if you have any queries or concerns around the resources, you can contact our support team in real time and they'll be happy to help. Really responsive as well, so you'll get an answer on that day as well. We've also got our Facebook communities, which you feel free to join up to now. We will post the link to the Q&A for you. So we've got an Ardens EMIS Facebook group, and that tends to be really active. We've got over 4,000 people, probably even more than that actually, where you can post your questions, or you can hear from other practices sharing ideas. It's also a way that we can keep you up to date as well. So it might be worth joining our Facebook group. So that leads us to next steps then, and what you can do from here. While you look at this screen here, I am going to launch another poll question because it would just be good to get an understanding how you would like to receive training. So do you prefer how-to guides, perhaps e-learning, perhaps webinars? This will then give us a good idea then of exactly how we can tackle training within your area. So do give us some responses to that one. How-to guides, winning, webinars. Perfect. Perfect. Thank you. So next steps from here. If you are interested in signing up for a free 3-month trial, then here is the link here. And I am going to get the guides to put this in the Q&A as well. So it's our trial form that you will complete. One of our accounts team will be in contact to get you all set up and ready for your 3-month trial. And during that time, we also recommend that your staff have a little bit of training as well. You can also contact us for a quote if you want more information. If you're ready to just get going for now, you want to skip the trial, you want to get straight into being an Ardens customer, then you can contact our accounts team and they'll be more than happy to provide you with a quote or more information, or even a demonstration for your practice if you feel that would be useful. And we've also got a link to our knowledge base site. So we've got a particular support article just for Wales practices, which I'm going to get the guys to link in the Q&A for you. And that just gives you information about, once you've onboarded, exactly how you can set up an account, how you can download our reports, what webinars are happening next, etc. So it might be worth definitely bookmarking that and sharing that with your colleagues. And that brings us to the end. So the last and final question is really to see what interest we have. So I'm just going to pop in a poll question to see if you feel that Ardens Clinical will be useful for your practice. Maybe you're not sure yet, and that's fine. We can always get in contact with you. We can provide you with more information if you need to. Perhaps it's something that you want to think about, but yes, if you could just fill out that poll question, that'd be great. And just while you're doing that, we do have our feedback form here. So if you have any questions that you would like to answer, so if you want to feedback on the webinar today, then please just scan that QR code there. That will take you to our feedback form to complete a survey. and we'll be appreciative of your comments. Chris, James, any last final things before we close the webinar?
Just a question from Jamie, Charmaine, that might be of interest to everybody. Will there be another demo on Ardens Manager, please? And how much is that facility? I was just typing, it's not quite available yet in Wales, but I don't know whether you want to add a bit more.
We've also got James, or we've also got Laura, who's our commercial director, who's been sitting quietly in the background, who I'm going to drop in a little bit as well. I don't know, Laura, if you're around and give us a little bit more information about Ardens Manager.
Yeah, absolutely. Afternoon, everyone. So Ardens Manager isn't yet available in Wales, just due to the way that we extract the data for Welsh practices and the corresponding EAMS infrastructure, but we are in active discussions again with the Health and Care Board in Wales. So watch this space and we'll be able to provide further updates, I'm sure, in due course.
Thank you very much, Laura. It's just to mention as well that we do have another webinar happening in September. So if you open up that Wales support article there, we do have, I'm going to pull it across here that you can see. We do have a webinar happening in September. So if you do sign up and you now want a bit of training to get you started, then that will be happening on the 10th of September at 1 o'clock. So you can actually register for it now. It's an open link. Even if you've not decided yet and you still want to find out a little bit more information, then you're more than welcome to join us on that webinar too. And that brings us to an end, and just on time as well. So hopefully you have all found that useful. Please do make sure that you do provide us with your feedback. Really appreciate you all coming today. We will hang around to see if there are any more questions, but if you're all happy, it's just the red leave button to leave the webinar. And just thank you so much for your time, and hopefully we'll see you on the next one. Thanks, everyone.